to see you. We are recording this. You would have had a little icon that popped up. So it's wonderful to see so many of you here today. I'm just going to do a very quick introduction. My name is Ranjit Kale. I'm Director of Communications, Stakeholder Engagement and Public Affairs at South London and the Maudsley NHS Foundation Trust. We've got an absolutely packed agenda, so I think this is going to be very, very informative for all of us, and we will be running at quite a pace. So please do forgive myself and colleagues if we move ourselves along at some pace. So I just want to say welcome. Please do relax, make yourself comfortable, and get ready for the agenda that we've got set up today. I just want to just say a little bit about the role of South London and Maudsley, which I'm sure many of you will be aware of, but we are one of the largest mental health trusts in the country with over 200 services, an absolute commitment to what is the key theme here, really, about participatory and community-based approaches to tackle health inequalities. You may have noticed that on the 30th of September, we published our new 5-year strategy, and one of those ambitions was very much about how do we work in a way that is a community-based approach, and also looks at how do we tackle racism, but also take a preventional approach in our work. So huge synergies here in the seminar today. And I just wanted to say a little bit about my role here, really, at the Maudsley, is very much about how do we work with our communities? How do we think much more about working with the people across the boroughs that we serve in very different ways than we've ever done before, which is really important because the world is changing and the services that we provide have to change as a result. And just a small example of that is a program we ran and are running called South London Listens, which has engaged over 6,000 people in looking at how we can put in support to prevent mental ill health crisis as a direct result of COVID-19. And so far, we've got a really positive level of support and raised just over £1 million for that program, which will run over 2 years. And so it's really fundamental that we take a very different approach to being able to support our communities. And again, thinking about the boroughs that are served here in South London as well. So I'm really delighted to be here. I will be your facilitator, moving us along. And just for housekeeping, there's a very handy slide that's come up. So please do keep your microphone on mute during the seminar. We really want this to be an interactive session as much as possible. So please use the chat function. If you could use the chat function right now to introduce yourself, and also just to tell us your name and what institution, organization you're from, that would be great. And please use the name you registered with on your Zoom profile. You'll be able to go into settings to make sure that works okay. And during the breakout discussions, please raise your hand if you have a comment, or unmute when invited. And you'll see at the bottom there'll be a way for you to be able to raise your hand. Any technical issues, please remember Madeline Boyton's name and email address. Madeline will be there on hand to help. We also want to create a lot of noise in a positive way in the social media world. So if you are in social media and you are tweeting, please do use a hashtag inside research, and that would be great. So please do that. And I just want to remind people about the seminar series aims. So this is a space to exchange knowledge, experience, information, learning ideas between all of us, really, whether we're academics, from health and social care staff, patients or service users, whether from local partners and local authorities, charities or other stakeholders. Everybody's welcome. And this is a great thing about this seminar series. So please do actively take part. We want to encourage as much collaboration as we can to provide a focus on the challenges specific to what's happening at South London. And I'm really looking forward to hearing much more about the debate and the discussions that are taking place, especially from my role as a board member at the Trust, whose real ambition is about thinking, how do we work out in a different way with our communities? How do we start to think about operating in a very different way than we have previously, which works to enhance people's lives and make people's lives as better as they can. So I've spoken a lot about the seminars. We're aware of the housekeeping. I know everybody will be very well behaved after almost 2 years of experience with using Zoom. And I'm just going to talk a little bit about the sessions today. So there's going to be 2 presentations. One of those is going to be focused on working together around a public research panel is going to be taking place. You can see that on your screen, hopefully. And the second one is going to be about involving diverse communities in maternity research, collaboration and co-production. And there's going to be plenty of opportunities for comments and discussions after the presentations. So please feel free to put your questions, comments in the chat function, and we'll come to those as we can. And you can see there we've got some brilliant speakers. So this is going to be no doubt a very, very engaging session. Again, you know, this is the third in the seminar, so very exciting. I feel that we are running slightly ahead, which is great. Absolutely great to see lots of comments in the chat function. Please do carry on introducing yourselves. That'd be fantastic. So I am going to ask Dr. Josephine Oklu to come up onto the virtual stage in a moment to begin a presentation for the first part, which would be great. And then we'll have Q&As afterwards. And I'm hoping that will be very engaging and challenging and thoughtful. So over to yourself, Josephine.
Okay, so good evening, everyone, and I hope you can hear me. Can you hear me okay?
We can hear you.
Lovely, good, great to get that confirmation. So my name is Josephine Oklu, and I'm really delighted to be speaking at the start of this event because it's such an important topic during these times. So I am the ARC's Equity, Diversity and Inclusion Lead, and I'm going to be talking to you as an example of participatory research about the setting up of the ARC South London Public Research Panel and what we are trying to do in terms of working together to build a community diversity and participatory approach to research and practice. So why is participatory research important? Well, some people have argued that, you know, participatory research is not actually something that was invented by researchers or educators or even community activists. Participatory research as a practice has always been in existence wherever different oppressed and marginalized groups have struggled collectively to understand and to take action, often to tackle inequalities of power in their social worlds. So there's something quite powerful about what we're talking about, participatory methods and approaches in trying to address inequalities of power. And the importance of a participatory approach was something that came to me very early on in my career, in my early 20s, fresh out of university, when I was working in Tower Hamlets, and I was working with many communities and minority ethnic groups who were facing huge inequalities of power and in their working and living conditions. And I began to really put into practice methods around a participatory approach without really understanding that that was participatory approach, because I was working with community organizations who were wanting to tell their stories and to speak about their issues from the bottom up, to talk about poverty, to talk about bad housing, to talk about racial violence. And these were voices of people who were often not heard. And so I was working with community organizations who were using collective methods of community organising to try and make sure that groups who were not usually heard were able to have a voice and to be part of developing those solutions for action. And so some of my thinking that I had been studying, about the feminist movement in the 60s and the idea of the personal is political was very much coming to life for me in the context of Tower Hamlets, when I was really, understanding that sense of, people's personal experiences are often rooted in wider social issues and the wider social context. And it's very important that people are able to talk about those issues from the bottom up, from their perspective, and to be part of developing the solutions. Later on in my career, I had a very terrible personal experience of medical harm. Many people know that. And I, as a harmed patient, then I started to become interested again in participatory research and how I could work with other harmed patients. And I realized even then, once again, that, as terrible as my own individual experience was, that there were actually many harmed patients, and it was actually really important to kind of work collaboratively to see if we could talk about what those issues were about and how they could be addressed. And I went on through my PhD to use a participatory approach. And if anyone wants to read about that, they can look at this article I published, Harm Patients Gaining Voice, Challenging Dominant Perspectives in the Construction of Medical Harm and Patient Safety Reforms. And so there's something again about that participatory approach, which provides a kind of tool for voices from the bottom up to be able to speak about their experiences and put forward ideas and solutions. And these are groups that are often not heard. And so a participatory approach is really important in that context. And in terms of the panel, the ARC Public Research Panel, it's been really great working with Claire Coulter, who's a public health researcher. And Claire has been, she's equally as passionate as I am about participatory research. And she's worked at both the local level and an international level, and previously in East Africa using those approaches. So it's really great to be working with Claire. So again, why is a participatory approach important now? Well, do we have to answer that question? We've all seen the striking inequities that have impacted many groups with the pandemic. So many different groups, Black, Asian and minority ethnic groups, but people on low incomes, people in undervalued employment, people living in deprived areas, poor housing and overcrowded or residential accommodation, older people, disabled people, people with learning difficulties, people with psychosocial disabilities, people with long-term conditions, especially those who rely on social care. Because so many groups have been disproportionately impacted. And this impact has been all the more devastating, as we know now, because these groups were already disadvantaged by structural inequalities before the pandemic began. And then, of course, we've seen the Black Lives Matter campaign. And this again has highlighted the huge impact of racism on Black and other minority ethnic groups. And again, it's kind of brought to the fore issues that have been around for a long time, but haven't been heard in the mainstream. And yet, despite this social and political context, we know that when we think about involvement of patients and the public, that there have actually been long-standing critiques about the limitations of patient and public involvement, the fact that it's not diverse enough, it's not inclusive enough, the models are too narrow. And therefore, there really is an urgent need now for more inclusive, co-produced approaches with patients, carers, the public in health, social care and research. And so basically, at the start of the pandemic, as we were kind of hearing about all of these awful stories about disadvantaged groups who were being particularly impacted, a couple of us in the ARC started to talk about whether or not we could do something at very short notice to try and put on an event which would give voice to some of those groups who maybe weren't being heard. And so it initially started off with me and Sally Hensman, who's the PPI coordinator. And I remember those conversations really well, and we decided at very short notice to try and hold a listening event. And also we were aware of the fact that there was a parliamentary call asking for evidence of the impact of the pandemic on groups across the protected characteristics. And so we decided to hold an event, a listening event, precisely for those groups, so they could talk to us about their experiences of the pandemic. And it was amazing because we held that event at really short notice and we had a fantastic response. People joined up very, very quickly. Within the first 24 hours of us putting out the invites with the great support of the ARC comms team, we had loads of people join us, almost 60 people. And then we went on to write up what people were saying from that listening event and to publish it in this BMJ article. The article speaks for itself. Being heard, not seldom heard, democratising research with diverse communities during the COVID-19 pandemic. And so I feel that I've been on a bit of a journey around this panel, and there are many members of the panel here today, and they've all helped to put this presentation together because we wanted to speak to you. And we've been on a journey together because after the listening event with the Zoom event, we decided to set up within the ARC a COVID research panel for the public. And we decided to make sure that that panel was made up of those very groups that were often excluded, groups of, across the protected characteristics, diverse groups who would be on the panel and who could provide that perspective, that community perspective from South London about some of the issues to do with COVID. Because we were aware that all these COVID research projects were being set up. And once again, there was a real danger of the groups who were being most impacted not being able to feed into the process. So we set up the panel, we invited researchers to come and talk to us, and it's been absolutely great. We've had loads of presentations. The panel only started in January of this year, and we've had all of these presentations about general practice towards end-of-life patients during the pandemic, disrupted bereavement amongst the Muslim community, COVID-19 vaccination intention, about Black, Asian and minority ethnic people hospitalised with COVID-19, learning from the COVID-19 health system shock and building resilient health systems, personalised self-management for people with long COVID, and evaluating the shift to remote consultation. So these are some of the main presentations which have been absolutely great to the COVID panel. And we've had really good feedback because we've been evaluating the process and we get people to kind of fill in feedback forms saying what that experience has been. And presenters have told us, and I chair the panel, they've told us that, the panel offers thoughtful and novel suggestions for studies. Feedback is constructive and helpful and direct and to the point. The experience is very easy, rich discussions happen with no prompting, constructive challenges and practical suggestions for recruitment are offered. People are given verbal as well as written feedback, and there's an opportunity to learn more about participatory and inclusive methods. And it was rather nice to get this feedback. If the person is in the audience, forgive me for putting this up, but it was rather nice to know that our panel was, helpful in helping that group to make their bid successful. And that presenter wrote to us saying, I wanted to let you know the good news. Our bid was successful. I really do think that the input from you and the PPI panel and our other stakeholders helped shape the bid and our ultimate success. Please pass on my heartfelt thanks, and again asking if they could come back to the panel, which was really lovely to get that feedback. So now I'm going to pass over to one of our panel members, Rachel, and she's going to tell you a little bit more from her perspective about why we need a diverse and community-based approach. So Rachel, over to you.
Hello and good evening, everyone. So why do we need a community-based approach? Community engagement as a strategy for research allows us to gain access to people who we are researching about, things that are happening to them, being done for them. It enables us to actually speak to those people and find out what they want, what they need, and what things are impacting them within their community and within their groups. And it's really important to do this from early stages so that we can make sure that we're actually researching the right things. And as a community group leader myself, often hearing about research and thinking, but who said that this was needed, or who said the community wanted to know about this? Actually, this is the thing that's really bothering them, has meant that being a part of this group, I've really seen where we've been able to say and give our views on research that maybe haven't actually looked at what the community groups, or haven't engaged community groups, or the people that are being impacted. Those groups haven't been engaged at the beginning stages. And so we've been able to sort of discuss that and encourage people to do that from early in research, to make sure that we are looking at what their actual needs are. It also enables us to build trust with those groups. Sometimes we might come back with the feedback and they're thinking, well, we didn't know nothing about this. So by engaging groups, getting them involved, enables them to feel a part of the research, but also for them to trust you and share their views with you. And I think that's one of the things that have come up a lot within throughout the COVID pandemic, that many people are distrusting of the services that are out there that are meant to be for them. And there are valid reasons for that, but then it's about breaking those cycles and starting to move towards improving those relationships. And it's, often people that are referred to as hard to reach that are actually right there. We just haven't communicated to them in the way that they understand, or via a person that they trust. Next slide, please. Okay. So community engagement as, oh no, we're still on the same. Oh no, okay. So co-production and peer-led approaches between researchers and community leaders gives a sense of ownership. And I think ownership encourages us to give feedback and get involved and find out what happens at the end of the research, and also for us to then share it into the communities that we work with, to our families, to our friends. And by sharing it, we raise the profile of the research, we raise the profile of researchers in general, and again we continue to build trust within those groups. And working with grassroots organizations enables us to amplify the voices of those groups that often are underfunded and doing all the work that the researchers are trying to find out about. They're actually doing all that work already, underfunded, not able to access the spaces that researchers are actually accessing. So working together with grassroots organizations enables us to have a two-way relationship where we uplift those groups and help them to access support for the work they're doing, but also to help researchers to find out what they're trying to look into. And it just shows that bit of acknowledgement and respect for those groups that are really doing that work out there. And I just want to highlight that these are not groups that often are already on the NHS list or already on the databases. These are groups that sometimes you have to go out and look for and find, and maybe they might be on Facebook and you have to dig through to find out who are they, whose needs are they meeting, and how can we work with them. So I'm going to hand over to Leah now, who's going to continue.
Thanks very much, Leah.
Thanks, Rachel. Thanks, Josephine. You can hear me okay?
Yes.
Okay, brilliant. Hello, good evening, everybody. Yeah, I don't want to go over, because Rachel's highlighted some really good points, but one of the things I'm always championing for is the ways in which we use reflexivity. So the ways in which we examine our own selves, our own values, our own basis, and use that to, I guess, inform what kind of barriers that we could be facing. So one of the things I always like to encourage people to do is keep diversity on the agenda at every meeting. And whether that's just as an agenda item that just rolls on and continues. And it's just a way of kind of always acknowledging that it's in the room, that we need to think about ways in which we're looking at diversity, ways in which we're looking at inclusion, whether that's as a team of people, whether that's as researchers, whether that's about the ways in which we go about engaging with people. And if through those conversations we're able to identify what challenges we might be having, and how this could be impacting on research development, then we may not always know all the answers to how we fix those things, but we begin to kind of have a bit more honest, authentic conversations. So I've got this typing at the bottom, so I can't see the rest of my slide. Okay, yeah, so one of the other things that I think is useful to think about is what strategies we put in place to reach people, so to reach community groups, and how we build those relationships so we can continue to reach those groups. So as Rachel had mentioned previously, sometimes groups are labeled as hard to reach, but actually they're not hard to reach. It's just that we haven't thought about how our own bias, unconsciously or consciously, might be impacting our ability to reach those groups. So I guess it's a way of tackling things like inequality, racism, but through perhaps more looking at the fact that we kind of have to dismantle internal systems in order to improve circumstances, in order to improve access to people and for community groups as well. And I guess we have to recognize the way that systems have to be changed and overhauled and shifted from the bottom up, but also from the top down, in order to make a difference, and in order to really, like I said, build those authentic relationships with groups, with community leaders. So yeah, also one of the other things I think is really helpful is using peer-led research and evaluation approaches, which was mentioned earlier. I think that when we begin to train people in communities to carry out research, train people in communities, not just to co-produce the tools that we use, but to actually go out there and be part of the actual delivery of the research itself, then we begin to start to shape and change things, because those people that we train, we can begin to work with time and time again. And those people will tend to, if they're already in communities and we're training people to do peer-led research, then we know that actually they may perhaps have better access to groups and individuals, but they may also elicit different responses from those groups because of things that were mentioned earlier, like building trust, etc. So those are kind of my main points, really, is kind of that importance about looking at self, looking at our own group identity or our own organizational identity, looking at the diversity within our organizational identity, and thinking about how that also might be impacting what we're trying to achieve in research.
Thank you, Leah and Rachel. That was amazing. Thank you. And so continuing on this journey now, we are moving beyond a COVID panel, and we are aiming now to embed a much wider public research panel in the work of the ARC. So that panel is going to be about, working with our experts by experience and our researchers to develop a broader model of patient and public involvement in research, grounded in principles of diversity and inclusion. The aim is to work with diverse communities in a more democratic process in our research, and to try and bridge the gap between researchers and the subjects of research, and to support researchers in their communication with research participants, and to amplify the voices of service users, and just builds that broader community diversity and participatory approach to research. So these are the forthcoming dates of our new panel, because we're early days now with this broader public research panel for the ARC. So if you are a researcher within the ARC and you'd like to come along to our public panel, please feel free to email me, and we can book you in to the panel. And so lastly, we're just going to introduce you to panel members, and I'm just going to play this little video because we put this together by way of introduction so that each panel member could say something about who they are.
You're broken down and tired of living life on the merry-go-round, and you can't find a fighter, but I see it in you, so we gon' walk it out. Ooh, the silence isn't quiet, and it feels like it's getting hard to breathe. And I know you feel like dying, but I promise we'll take the world to its feet. Move mountains, bring it to its feet. Move mountains.
My heartfelt thanks to all of our panel members for working to build this panel. Thank you very much for listening to us.
Thank you so much, everybody. Josephine, Rachel, Liv, absolutely amazing presentation, and I know there's going to be a very rich level of debate and questions as we go through this. But and a very powerful video. So thank you very much, and lots to learn from that. So it feels that we could hear from you all night. But we're going to move on to the next session, and then we'll have a Q&A after that, where we can talk about the two presentations. So please, everybody in attendance, we really want to hear your questions. So do put us in the chat function. That would be great. And I'm now going to introduce our second presentation, which is from Dr. Abigail Easter, ARC South London Maternity and Perinatal Mental Health Theme Deputy Lead and Senior Lecturer in Maternal and Newborn Health at King's College London, is going to talk a little bit about involving diverse communities in maternity research, collaboration and co-production. So what a wonderful theme, and builds very nicely on what Josephine and colleagues have said. So Abigail, I'm now going to hand over to yourself.
Thank you so much. So I will just get the slides up. Hopefully you can see the slides.
Yes, we can see you. Yep. Brilliant. Yeah, we can see them. Thank you.
Great, thank you. So yeah, I'm delighted to be here to present some of our themes, co-production work, and to kind of join in with the fantastic presentation that we've just had. So we're going to be talking today about some of the work that we've been doing within the maternity and perinatal mental health theme, and particularly focusing on a co-production training event that we held in April. So I'll be joined today by Agnes Adjupon, who is the chair of Maternity Voices Partner at Guy's and St Thomas's, and also Mary Newburn, who is the patient and public involvement lead for the theme. So the work that we're going to be presenting today has led to this report. So just as a starting point, this has been launched this week, and I just want to acknowledge all of the input into this report. So this really has been a co-produced training event and co-produced report. So just to give acknowledgement to the authors of the report who aren't speaking today, to Emily Ahmed, who has led the training, and also to our other facilitators, so to Vita and to Catherine and the rest of the research team who have been involved in this work. So before I hand over to Agnes, who's going to talk about her involvement within the network, I just wanted to highlight some of the kind of founding principles of the work that kind of underlie our research. So it's not unique to South London, but it is something that our research is really focused on. We know that for all the reasons that have been spoken about in the previous presentation, that we see poorer outcomes for women and babies who are living in areas of social disadvantage, those with mental health difficulties or other comorbidities, as well as those from Black and Asian and minority ethnic groups. So the focus of the research programme that we're working on is really looking at what are the reasons for this, what models of care or support can be put into place to help with this. And obviously, as the research has gone on, we've seen how this has really kind of highlighted some of the issues during the COVID-19 pandemic. So we've introduced work in response to some of our public and patient engagement work to look at really how the COVID-19 pandemic has affected these health inequalities. And involving women and community and relevant organisations has been part of our strategy from the beginning of our work, which hopefully you'll kind of hear a bit more about as we go through the talk. So I won't go into the details of all of the projects we're running. These are on the ARC South London website, but I just thought I'd highlight that we have a number of projects that really are working together to kind of try and answer some of these questions. As I said, public and patient involvement really has been at the heart of what we've, the research that we've been doing within the maternity and perinatal mental health research theme. And we've been including service users, networks, communities and charities really from the start. And this is an image from one of our first engagement events that we held online. We had a lot of interest from local community organisations to become involved in the maternity and perinatal mental health public and patient involvement network. And this has really been facilitated by Mary Newburn, who is our theme public and patient involvement lead. So I'm going to hand over to Agnes, who's going to now talk about her involvement within the network and some of the things that we've been discussing before Mary moves on to talk about in more detail the actual co-production training event that we held.
Hi everyone, thank you so much Abigail for handing over. So my name's Agnes. And I began to be involved in the theme, I believe it was April, via my lived experience and being a Maternity Voices Partnership Chair, and also as a recent, at that time, recent service user of maternity services. Next slide. So one of the things, there's many different amazing things that I can say about my involvement with the theme. You know, initially when I joined, it was, you know, I'd sat on quite a few different steering committees and so forth, and I didn't know whether I was able to kind of voice my opinions and speak candidly, or whether it was a place I needed to censor myself. And very quickly, I understood that this was actually a place about authentic co-production, a place where my views and my opinions and my voice could be heard. And what did that mean for me? And what does that mean for women or for service users like myself? Well, it meant that not only could I speak my truth, but because I was able to speak my truth, I was able to open up a kind of a whole different array of dialogue that potentially may not have happened. A question that I'm always asked, or I was always asked at the time, was, you know, Black women are kind of hard to reach in the kind of maternity and perinatal space, and that people were really struggling to engage for research purposes. So as a result, you know, I was encouraged to write a blog to answer these questions. And actually, it's quite ironic because I thought I would write this one blog to kind of get it all out. And actually, I made a bit more work for myself. But the blog, which sat on the National Institute of Health Research, was why Black women are not engaging in research and what can be done about this. You know, this is not, and I think, and I'm alluding to the presentation and that previously happened with Josephine and with Rachel and with Leah. This is not an issue of Black women or minoritized communities being hard to reach. You know, I always say, me as a mum with 3 children, I more than anybody want an uplift in my community. I want an uplift in improved outcomes within maternity care. I don't want my children to be twice as likely to be stillborn. There's nobody that wants an improvement in this area than somebody like me. So then the question is, why are we not being able to solve these problems? Why is there a lack of engagement? And my next slide will kind of allude to some questions as to why we can do that. But the key point here with the theme is that I've been encouraged as a service user to kind of speak my truth. I've been encouraged to kind of, or being given the platform to be able to write and express my opinions and actually create a dialogue, not just within the theme now, but within a wider kind of health setting. So one question, so here's a few questions for retrospection I really would like anybody that's finding challenges to engage with. This is about the Black community, but I also believe that these are questions that you can ask irrespective of any kind of marginalized community that you're struggling to reach. You know, how we can all play a role in bringing about change. So are our leadership teams reflective of the types of audiences we are trying to reach? What Black researchers are we working with on this project? What Black networks are we reaching out to and co-producing with? Are we funding our partners adequately? Is our approach transactional or relationship-led? And how are we collaborating with and amplifying the voices of those who are already doing the grassroots work within the community? And again, I just would like to thank the theme and everybody involved with the theme for actually giving me the platform and the voice to not only just write about these kind of issues that are really important to myself and communities I present, but also amplifying my voice. Thank you.
Thanks very much. I'm really sorry you can't see me. For some reason, my camera's not working, but was just half an hour before we started. There have been some fantastic contributions so far, and I'll just add to that a little. Following on from Agnes's wonderful blog, challenging blog, we applied for some funding to do a joint piece of work, co-produced using participatory appraisal methodology. And as people have said, it's part of this work, a huge part, central part is about values. It's about respecting people, reducing power differences, putting those that we want to participate at their ease, making sure that every single person is valued, and anticipating and responding positively to their needs. The questions we asked were, how can researchers work with diverse communities more effectively? How can we share power? And how can we overcome the barriers to full public involvement within research systems and culture? Thanks, Abby. And we used two participatory appraisal methods during this training, which was for about 28 people, half and half researchers and service users. This is the finished spidergram with all the post-its from all the different breakout groups. But first of all, researchers worked separately in groups together, and community members and service users in their own group, each addressing what they perceived the barriers to be. And then we swapped over, and each group worked on potential solutions that the other group had put forward. Next. We had some talks, and then we went into small groups again. And for the second part of the training, we had mixed groups of researchers and service users, and looked at how we might implement those proposed solutions, with some do's, with some don'ts, and with some remaining questions. All of this we've written up in the report. Thanks. So the key messages really are, if you want to involve communities, you really need to have a consistent community focus. It's not rocket science in a sense, but it's very frequently overlooked, and people don't really understand what that means. Communication is absolutely key. Funding is crucial, and building trusting relationships, as people have said time and again. We need to keep on addressing power imbalance, and that's very difficult in hierarchical university settings. And those kinds of things, I think, are necessary, but they're not sufficient for diversity, inclusion, and addressing issues of equity, but they don't half help. And those kinds of values and the practices that I've mentioned are the sorts of things that need to go right through the work, through the teams, through the work we do, like a stick of rock. Thanks, Abby. So we're now tweeting some of the recommendations from the report. So just as an example, and we have so little time, but for community focus, as people have said, ask the community what's important. Always think about reciprocity and making sure that everybody who's involved benefits from the process, and advocating for community-led research is really important. Thanks. For communication, lots of things to be said, but short, clear communication when it's written, getting advice from communities, and making sure that social media is being used effectively are some of the examples. Thanks. Funding is crucial. It underpins everything because time of everybody costs money. And the key thing is making sure that PPI, community involvement in research, is planned carefully at the beginning when funding applications are being made. It's too late later on, And I think a lot more help is needed in terms of getting that right at the beginning. So we're doing some work on that at the moment. Thanks, Abby. And the last slide that I'll share with you is this focus on trust, being respectful and appreciative, and building relationships with key community influencers. And finally, are we sharing power? Constantly asking that question, and what could we do differently? Next. So that's us. It's a whistle-stop tour, but please have a look at the report and retweet the messages that are being sent out by the ARC comms team. Thank you.
Brilliant. Thank you so much, colleagues, for what has been a fantastic presentation. Both presentations were amazing. So much in there, and I found myself switching my camera off just so I could take pictures of the slide deck that was going on. But I'm sure it's going to be shared, and lots to happen. So we are, we are tight slightly on time, but we have got time for Q&As. So it'd be great if anybody wants to ask a question of the fabulous presenters that we've had today. Please do put us in the chat function. I would be grateful. And then after that, we're going to go into breakout sessions. So I would really welcome any questions. I can see there's a few that have come through, but I wanted to just start off with a quick question, if I could, just whilst I've got the stage. Josephine, I just wanted to ask yourself and colleagues really in a sense of about the participatory research approach. What have been the biggest challenges of getting organizations or institutions to take this approach forwards and like to make it mainstream? What have you found as the main challenges?
Well, I think there have been a lot of challenges, and we haven't cracked them yet. But I like to feel that within this climate, it's a kind of, if we don't do it now, when are we ever going to do it? So I think there's kind of been a burst of, we just need to start speaking about it. And that's kind of a starting point. I think there's been an issue where we haven't really understood why we should have a participatory approach. I think that there has been a movement to look at patient and public involvement for a long time, but patient and public involvement, to be perfectly honest, has had a lot of failings in excluding many voices. And many diverse voices, and to be perfectly honest, that's been written about time and time again. So it's only with the pandemic that I feel that issues around participatory approaches are able to come to the fore. So I think what is great is that we're having this conversation. I think this event is so important. I'm so delighted to participate with the panel, because the panel are really great champions. And I think the challenge is that we need to build the approaches into the structures, because I think the structures in research haven't necessarily been set up in a way that will allow us to do research in a participatory way, because we do things really, really quickly. We don't necessarily have those diverse groups in the room. We don't have the contacts with community people. So there's quite a few challenges. And what we've started to do at least is to say, well, we've got a structure to try and address some of those things. So we're at the beginning, but we've got some real experts by experience on the panel from the local community. And collectively, we can start exploring within the ARC how we can develop those approaches.
Fantastic, brilliant, Jonathan. Thank you so much. And absolutely, I know a lot of people will be watching with fascination and just amazed at the work that you're all doing. So thank you. I've got a question, Abigail. I'm going to put it to yourself, but Kelvin has asked, what support do you give to the father so they feel they're being treated equally in the same way as a mother? Is there anything you could share on that?
Yeah, it's a really good question. And I think predominantly for the start of the network, we have kind of been focusing on mothers' experiences. We are involved in another group that I'm involved with does have engagement from fathers on it. And I think it's really important to make sure that voice is heard there as well. So yeah, I would just agree that it's an important point. I don't know if Mary, if you wanted to add anything from your point of view on that.
Just to say, I think it's an important point and certainly some of the projects that we're involved with are looking at the needs of partners and fathers. So far in the network, we have had, we haven't gone out and specifically engaged fathers, partly because the ARC funding is specifically looking at outcomes for mothers and babies. We've had very limited funding, and one of the things that we have done is try to be really focused on our key question. And I think sometimes it can be a bit of a risk to try to do everything and skim over the top, and our real focus has been working with Black, Asian and other minority ethnic groups of women in maternity and in perinatal mental health. So that's been our focus.
Thank you very much for that. I was just going to say there's a lot of love for both presentations, both panelists, groups, and so well done, really tremendous. Thank you. I was going to ask, there's a couple of other points I just wanted to quickly raise. We will finish in a few minutes, so please do keep your answers pretty brief. Dorota has asked, great presentations regarding the long-standing critique about patient and public involvement. Whilst there's so many true co-production projects happening across the country, how can we resolve the tension? What are the next steps? A big question, but maybe Josephine, if I go to you, what would you say in a sentence or two, do you think, to what Dorota's raised there?
Well, I've been pushing the equity, diversity and inclusion to be centrepiece of patient and public involvement. I think it's been missed out. I think you've got to put that centre, and I think that you've got to explore methods for broader participatory ways of working rather than just kind of handpicking a couple of people to sit on a committee. Brilliant.
Thank you. Thank you very much. And just my final point to just a question really is if there's one lesson that you'd like to leave with everybody, what would that be? I'm going to come to Abigail first, and I'll come back to Josephine. What would you say the one thing that you've learned that you want others to take away? Abigail, what would that be for you?
I think for me, it's about this kind of experience through the ARC as being kind of that involvement at every stage. So involving people from the beginning, those early conversations. From a research perspective, has just been so important for shaping the work that we do within our research teams.
Fantastic, thank you, Abigail. Hugely important. And Josephine?
For me, it's kind of always trying to remember that I'm not the expert, and I think that kind of research promotes professional experts, and I'm just so humbled by the people that I'm working with on the panel because they come with such great expertise. And so it's a reminder to me there's so much expertise out of the room that can help us to solve these problems who don't often get a chance to speak. So I'm kind of devoted to bringing in those voices.
Brilliant. Thank you, Josephine, Abigail, and everybody who's presented today. I think you have done an exceptional job, and I know everybody in the chat function is agreeing. So please do continue to share your love and enthusiasm for this work and for colleagues who are doing such a fabulous job in this area. So a huge thank you. So we're about to go into our breakout sessions now. So discussion questions will be on the screen. I'm just going to read out some instructions that will hopefully make the next session a little bit easier. So do bear with me. So you're going to have 20 minutes to discuss the questions. You can see them on your screen now. Now, the good thing is that we want a richness of debate here. So you don't need to cover every question. Don't have to struggle to do that. But we also want this to be really engaging, and we want people to get involved and to really make the most of this wonderful seminar today. So please do have your cameras on for discussions because you'll be in small groups. There's going to be a facilitator for each group to guide you through the sessions, but could you please identify a note taker for your group, just so that we can make sure we capture the notes. We'd like to collate the summaries of the key discussion points and circulate those to researchers after the event to inform their research. So that's really important that that happens. So please do identify a note taker and get involved and engage in the conversation. And there'll be a countdown at the end of your session, and you'll be returned magically back to this main meeting room. So without further ado, you should be finding yourself magicked away into a wonderful breakout group for the next 19 minutes, I believe. And we shall see you back here in the main room. I hope you have a wonderful and productive working workshop group. Welcome back, everybody. I hope you had a really productive group. I know that the group I was in was fantastic, really deep, meaningful conversations. I hope that you did manage to nominate a note taker, and what I'm going to ask you really to do is, I just want to keep this session open and flowing. So I'm not going to ask for everybody to kind of give their feedback and to go in turn, because that will take forever. We'll be here till about 11 o'clock at night. So what I was going to suggest is, there's going to be a poll dropping in a moment to ask for your feedback on the event as we get to the end. But before that, I was just going to, here's the poll. So you can fill that poll in. Just quickly let us know how you think this event's been going. Please do that. It's really important that we capture your feedback and improve this for the future. So I mean, I think it was great, so I'm just going to say that. But also, so just in terms of feedback, can I ask people to put into the chat function feedback from their group? Let's start a conversation about some of the stuff. And does anybody want to come forward from a particular group to give some feedback? Yeah, I can see Vita. Do you want to share a little bit?
Yes, thank you. We had a great room, and there were a couple of things that are kind of stuck in my mind that were said, and in particular about having like the necessity to understand that sometimes people want to participate and they want to be involved, but they question why. And then throughout our conversation, what kept coming back was understanding the aim and the objective in the longer run, and being part of this development of the research in the longer run. So not just saying something and then being dropped from the perspective of like a service user or a member of the public, but actually staying within this relationship and then seeing where it's going. So there were lots of other things that were said, but this particular aspect, I think was very important.
Peter, very well said. Really, really, I think hit the nail on the head there. Lots of points that I think we need to take away. Can I just, we do have a bit more time for feedback. I know there's such a richness, and Vita's just beautifully articulated some of the comments coming out of that session. So is anybody else wants to share some of the feedback? I can certainly, Rachel, yeah, fantastic. Over to you, Rachel.
Hi, sorry, there's just something I forgot, and someone put something in the chat that's just reminded me in terms of incentifying the work that we do. And I think if you want to get a really good pool of people to engage in research, then you need to make sure that we're not only accessing people that are from a place of privilege. And when I say that, if I want to say it very bluntly, if it's going to cost them childcare, or take them away from their jobs, or take them away from time that they could be doing something else, then we should incentivize that and remunerate their engagement and their involvement, and make it worthwhile for them to be a part of it. As much as they want to help and make change, if they're not incentivized, many people can't engage because they don't have the privilege or the option to. And I think that's something that all researchers must factor into their budget planning, their bids for research, making sure you think about the people that I'm going to engage. They're going to be covered financially for their time and their effort and their expertise as well, because some of them will have expertise that will bring so much value to the research. So I just wanted to say that, because I wouldn't have been able to sleep without getting that one in.
Yeah, absolutely, Rachel. I can see people clapping there, so so definitely right. Thank you. And is there anybody else who wants to share some thoughts? Yeah, just want to check. I can see Mary Newburn is clapping, but I'm not sure whether that's a hand up. But Mary, if you do want to come in, please do come in.
Thanks. I was clapping, but I will use the opportunity. I think funding is absolutely fundamental to all of this. I think that it's vital to acknowledge the participants who are either involved in the design of research or participants in studies appropriately, but involvement needs to be properly funded. But things like, one of the things that came up in our group was researchers feeding back on what they're doing differently as a result of the advice that community members are giving. And that takes time, quite a lot of time, because there may be many suggestions that are made at many different stages. So it's absolutely fundamental to get these costs into the funding applications at the outset. And I think that unless you have a research team who are absolutely committed and experienced and knowledgeable about doing community engagement, then having somebody a little bit independent who can work as an intermediary, hear and understand the researchers, and support and network with community organisations and try to sort of bring the people together. And in maternity, I have to say, we've got a fantastic network of people now, and many of them are here today and working on lots of other panels within ARC. And it's fantastic when you do that investment at the outset.
Brilliant, Mary. Absolutely right. I think a lot of people nodding their heads, so you've definitely hit a note there. We've just got a few minutes left, so if anybody else wants to share, but whilst we are doing that, I mean, in the group I was in, we spoke a lot about some fabulous comments around engaging people really early, making sure researchers are connected to where the data is coming from, questioning, challenging, being connected to the audiences. We talked about better training on equality, diversity, unconscious bias and privilege, and also, making sure we reach out deep into communities, people who are not on lists or groups and others, but making sure we can really get connected. So I was going to just say, absolutely, colleagues are putting in the chat function quite rightly. Please do email madeline.boyton@kcl.ac.uk if you're a note taker. What you've been through and you're sharing today is absolutely amazing stuff, and that we want to capture, the researchers want to capture and make sure we can put this down into our work. So please don't miss that opportunity, and please do email Madeline there. And also in the chat function, you'll see an opportunity for how you can click on the 3 dots somewhere and save the chat if you would like that. But so I was just going to ask, I can't see any final hands up. So thank you so much, everybody. I'm now going to just start to bring us to a close, really. And I know I've certainly enjoyed the session today. I'm a bit sad that it's the last seminar of the year, but I'm sure there's going to be plenty more amazing seminars coming up in 2022, and such a rich debate, and a really purposeful debate. I think a lot of good conversations have happened, meaningful conversations, and we've got into a lot of depth in such a short space of time. So I just want to say thank you so much to facilitators, note takers, people that took part in the workshops, gave your time up this afternoon. I'm very grateful for that. A big thank you to the organizing group. It always feels like it's easy and seamless putting on events like this, but it's not. Trust me, people have been doing some really hard work behind the scenes to make this all possible. So I just want to say, and you can do if you've got your camera on, just do a physical hand clap. If you haven't got your camera on, just do a virtual one. But let's give a big thank you to Madeline Boyton, Abigail Easter, Michelle Harris-Taffery, Savitri Hensman, Vita Molatido, I hope I said your name right, Mary Newburn, Josephine Okalu, Nick Sarson, Jane Stafford, and everybody else who presented. I know some names that aren't there, but that presented. You were amazing and great, and I really think you filled our evening with lots of knowledge, lots of information for us to take away, and a lot of fuel for us to be able to hopefully go away and make great things happen. And the ARC is a great example of where things come together and let us make these things happen. So thank you very much for that. I'm just reading.
And thank you to Ranjit for great sharing. It's really been great, Ranjit. Thank you so much.
Brilliant. Thank you very much. I'm very grateful.
Yeah.
Thank you. I'm very grateful, and I was a little surprised to be asked, but delighted. I'm not sure you'll ever have me back, but really grateful. So just a quick note for future events, please do put this in your diary. Inside Research will continue in 2022. Very glad to hear that. You can find out more there. Go to that URL. I won't read all of it out, but you can see. Please do follow at ARC_SL for more information, latest information, and get active on social media. The active involvement in research event involving people from diverse communities in co-producing research. Nothing About Us Without Us is Monday. It's actually Monday, 22nd November, 6 to 8. I wonder if we need to, we'll put the poll back up, because I think I went slightly early on the poll, but I will also be sharing a recording of the event, and hopefully we'll be sharing the slides as well, because I know there was such fantastic stuff in there. So yes, please do have a look at all that information there on that slide. If you've got a camera, take a picture of it, so you can do that. And I think that brings us to a close, really. Just 2 minutes ahead of time. Thank you, everybody, for joining, for giving up your evening, and for your contributions for what has been a really marvelous evening. So I'm just going to say that if everybody can put their cameras on very quickly. You might be eating something. Let's just get everybody to put their cameras on very quickly, so we can see everybody. Wonderful. The cameras coming on. Amazing. And just turn yourselves off mute if you can. Yeah, just turn yourselves off mute, and just give everybody a round of applause, and good day and good evening. So thank you very much, everybody. Marvelous work. Well done. Have a lovely evening.
Thank you.
Everybody.
Bye-bye.
Bye.
Very much.
Bye.
Can I ask a question before I go, Madeline?
Oh, what's the matter with this?
Hi, Catherine.
Is there